Hi, how are you? Good morning. Thank you very much for attending. Good morning and welcome everyone. We welcome you to our webinar, Homes with Older Adults in the Face of the COVID-19 Pandemic, the Importance of Intergenerational Social Capital. From the CIS, receive warm greetings on behalf of both our Secretary General, Dr. Gibran Ramirez Reyes, and Dr. Daisy Corrales Diaz, Director of the Inter-American Center for Social Security Studies. Likewise, we welcome all members of the American Commission of Elderly People, Mrs. Estela Laura Tales, Mrs. Jalili Muñoz Chacon, Mrs. Edgar Diaz Garcilaso, Mr. Patricio Epifano, Mr. Rogerio Nagamime Constanzi, and Yamira Yusime Campos Suarez. Today, Dr. Diego Terán, who is with us at the facilities and is a specialist researcher for the American Commission on Older Adults, will coordinate the activity. And myself, Laura Elena Vidal Correa, coordinator of the research program of the American Social Security Commissions. The main objective of this activity is to analyze the importance of the social capital contained in the different household configurations that support older adults in the face of the COVID-19 pandemic, both in the Americas and in the Caribbean. The demographic transition of the elderly population will have a strong impact on socioeconomic aspects in the decades to come. There are currently over 1 million people 60 years of age or older, and the majority live in developing countries. Although the modality of nursing homes for the elderly emerged as an alternative, there are not enough to assist the elderly population in need and in these spaces of social commitment for public assistance by governments. There is now a growing need to it, which has allowed a great development of options for retirement homes as providers of community services and creators of new work spaces. The increase in the aging population, the increase in the population, the increase in life expectancy, the increasing trend of loneliness of older people, and the risk of economic vulnerability, which grows due to the impact of the current COVID-19 pandemic, place these gerontological spaces facing a scenario never seen before. Aging in a retirement home can have advantages and benefits for those who decide to live there, for it will be by choice and with options of possible care for personal well-being and safety. In addition, this kind of spaces become also new work options for professionals in the field of aging. Today, retirement homes have been found with cases of infections by COVID-19, facing deaths with a dual in isolation. For people over 80 years of age, the mortality rate can be as high as 20%. In Argentina and Mexico, among other Latin American countries, massive infections are reported in nursing homes. And also we find the death in loneliness for elderly people living without their family members and facing health problems. The pandemic and the quarantine have forced changes in the way homes provide their services to the elderly population, but also to the people who work there and who have had to change their routines and procedures which had been carried out for many years. After the pandemic, for sure, we'll need to think about what type of old age we will have to be assisted in these spaces in the future. Also, homes will have to adapt to the demographic changes and social environments they belong to. As I was saying, Dr. Terán from the CISS research team, who has organized this event and who will coordinate it and who will continue with the activity, will present today's agenda. I will briefly give a bio of Dr. Diego Terán and then I will give him the floor. Dr. Diego Terán is a doctor in population studies and a teacher of demography in the Center of Urban and Environmental Demographic Studies of the Colegio de Mexico. He has a degree in economics from the Autonomous University of Zacatecas, and he has taught demography courses at institutions like the National School of Anthropology and History and the National Autonomous University of Mexico. His work experience has been focused on the research of population phenomena related to the international migration between Mexico and the United States, the transformation of population profiles and the demographic aging, and the design of indicators that show discrimination and inequalities among the Mexican population for the CONAPRED. He has worked as an associate researcher in projects developed by institutions such as the Center for Research and Economic Teaching and the Autonomous University of Zacatecas. Welcome all speakers. Thank you very much for participating. And Dr. Diego Terán, please, the floor is yours. Thank you. Well, good morning, Mexico. Good afternoon for those that accompany us from the southern part of the continent. It is an honor for us today to present this webinar entitled Homes with Older Adults in the Face of the COVID-19 Pandemic, the importance of intergenerational social capital. Not without first acknowledging that today we're going to have a conversation with a luxury panel where we are accompanied by Dr. Graciela Zarevsky from Argentina, Dr. Mariana Paredes from Uruguay, and Dr. Marisa Vivaldo from Mexico. Before continuing with the seminar presentation, I want to make a mistake correction. The presentation by Dr. Mariana Paredes in the invitation that circulated as on Monday included the title, Seniors and COVID, Challenges for Coexistence Among Seniors, being the correct name, Seniors and COVID Challenges for the Coexistence Between Generations. A mistake on my part, so I again apologize to Dr. Mariana for the inconvenience. I would like to remind you that throughout the webinar, we will have a chat for the questions so that you will be able to interact with the speakers, or if you prefer it, you can send those questions through the mail that will be answering the questions, laura.vidal@ciss-bienestar.org. Without more as a context, what has been the origin of the today's topic, in which brings us together here virtually, it is also to discuss a bit the impact that COVID-19 has had on people in general, but mainly on a vulnerable group such as elderly people. The first studies of what has been known about COVID and its behavior in different countries in the world tell us that older people are not the most infected ones, but once they are infected, they are the ones who are at a high risk of death, which has placed them as a population at risk. Therefore, given the policies of several countries in confinement, it is these people who are the most affected ones by physical distance, which has sometimes become a social isolation with extremely important effects. These effects of this pandemic are not only with respect to health, but they also have to do with different perspectives. With the economic aspect, in the aspect of care or support for the elderly, in the process of adaptation to a new normal, and above all, in the health impacts for those who have suffered from the disease. Not only those who have survived, but also those with possible chronic consequences. What shows this pandemic to us by facing the new realities we see, it makes these asymmetries grow and social inequities in the countries and within the countries. It is evident that this new normal gives us a challenge to rethink things and have a change to a new normal and reality with an impact to the well-being of all the population, but especially for older adults. There has been harmful effects due to isolation, mainly to the population that we are dealing with today. And this is because many of these people have a greater probability of facing what are chronic degenerative diseases. Isolation and everything that has caused this social distancing This confinement has led to many of these people to have their treatments interfered with many short and mid-term consequences. And this could be very serious in the future. We are interested in the issue of multi-generational arrangements and independent residence for older adults because, as we know, in the American continent, residential arrangements are not the same everywhere. We see some countries where older adults predominantly live at home alone with their couples in the same generations, and we do not have that intergenerational exchange, while there are some other countries where there is an intergenerational coexistence where grandparents live with grandchildren or with their children, and there is a real transfer of information, such as the concept of social capital, support networks, a communication network, and above all, resources that are not materials that have to do with solidarity. Some data could tell us that by the year 2000, Argentina had the highest number of households with elderly people, followed by Chile, Panama, Paraguay, and Mexico. And when we talk about homes where the elderly live alone, we would have the first place is also with Argentina, followed by Bolivia and Panama. This dimension of older adults living alone increases when we go to the rural dimension field. As for the percentage of households where older adults contribute to the income of households with more than 50%, we have that the first place is taken by Brazil, followed by Uruguay, Bolivia, and the Dominican Republic. While in those households where the contribution to income is not so evident of more than 50%, then we have countries like Mexico, Peru, and El Salvador. It is interesting, and one of the topics of this webinar that has to do with the concept of social capital, rescuing it from 1986 by Baudou, who says that social capital is all that concept that tries to materialize or capitalize or shares everything that not properly have to do with the economic question, but with the support networks, with communication network, with access to information. Therefore, now we put this forward on the table, the question that originated this webinar, which is how do older adults who live alone or with their couple face the pandemic and confinement compared to those who live with children and grandchildren. That is to say that the pandemic has led us to confinement, but it is not living the same way by those people who have family support or those who live alone. Therefore, the challenges we face today not only do have to do with health, but would also like to place it in a broader concept that has to do with social security. That is to say, things that have to do with income, pension, retirement, access to health, and some other issues that include social security. Social security, we must remember, is conceptualized as a human right. Therefore, anyone on the planet should have access to these types of rights.
So, according to one Chan, dates back in 2013, in Latin America, only 4 out of 10 people over 65 receive a pension due to retirement. So, what we're about to discuss today, as part of this matter of discussions, is analyzing the multi factors that our aging population are facing amidst a pandemic. So, our panel is constituted by multidisciplinary keynote speakers because each participant will share their vision about the impact that this phenomenon has had on the aging population, our adults. Just to wrap up, I want to express the process of the event. Each panel member will have a maximum of 25 minutes to share their presentation. 3 minutes before they run out of time, we'll let them know so they can get ready with their closing arguments or speech. Now, without further ado, we're going to start now and discuss the first presentation given by Ms. Graciela Zarevsky, which is called Protecting Factors and Resilience of the Elderly During the Pandemic. Now, she is a doctor in psychology, thanks to Buenos Aires University. She is a dean of Mayores University in the area of humanities and social studies and entrepreneurial activity. She's also the lead in the analysis of the aging population and masters in other disciplines. And she's also a director, and she has a PhD in analysis of what happens with the aging population. She's also been leading many conferences, and she's part of the program from the Ministry of Health from the city of Buenos Aires. And she's been a keynote speaker and professor in different universities like Spain, Mexico, and others. In her areas of research, she works in the area of the study of the elderly or the aging population that date back to the core, and she analyzes the complexities of aging, the pathologies of aging, psychological risk factors, and other capacities in the area of analysis of the aging population. She's been an author of different books. One of the recent books led her to compile the, flexible identity as part of life, and she has many other books. She also has a Chronicles of Aging. Aging, is it a fall? Condemnation of the elderly, condemnation of the seniors. There's many other journals or documents that she has been writing. Well, thank you, Ms. Graciela. We thank you so much for being part of this. Well, it's a pleasure for me to be here with you. I hope you can listen to me fine and you can see the presentation as well. Are we all okay? Are we? Yes. So we begin. Well, my intention when sharing this with you as part of the challenges, I mean, for the elderly amidst a pandemic, we have to think about resilience, which enables or that allows the elderly or the aging population to develop that resiliency amidst the situation. What you were saying, Juan, is also correlated to the implications of being physically distanced from others. This, in our elderly, this distancing did not transform in the elderly, which developed resiliency in a social lockdown. And what seems to be very interesting for me is to start by mentioning the concept of social impact here. What I will focus on today and will share with you and transmit is that there's something that makes the elderly be capable of capitalizing with social capital. If our seniors are open to networks and it's part of the concept. And at a personal level, a person that has these resources has to develop their resources, which we call social reserve. It's a concept that's similar to social capital, but in this case, Victor, the person has to know what do they have humanly in reserve, and to see the factors that enable our people or elderly to develop that resiliency. As you said, the core theme of aging has been it's been object of debate. Unfortunately or fortunately, there's positives in the pandemic. Many have discussed the situations amidst the pandemic. Juan mentioned that our people are vulnerable, but if we have it clear and know that there's vulnerability, but if there's also logic in it, my intention is to discuss vulnerability and how we fight it. What is the counteraction in the core elements of our people? That's what I call the flexible identity of our people that can fight back those vulnerabilities. And what we discussed, first of all, was in regards to the pandemic. In regards to the pandemic, the elderly, and I know that many elders in my country and in Latin America, I mean, there's a lot of prejudice, and they were so clear, and that was good at some point. They've been expressed, the prejudice has been expressed, and that prejudice that it's unveiled has led us to see that the elderly now can have an active position and become fighters against those prejudice. Now, our people have to be as active and participate and be capable of fighting back and having a positive fight against these prejudice. We have to think about what's happening biologically. And, well, sometimes we're alone most of the time, but the situation has led us to understand that aging, of course, has led us to show the quality of aging in the segment of the aging population. Now, as part of the problems that were clear For the elderly, we see that we need to draft a whole chapter about it, about what's happening. Our people are living sometimes in their homes, whether they're alone or with others. And we were talking about the relationships in families. And we have to analyze everything from the standpoint of the aging population. I will start by saying I'll talk about different research in Latin America that are the bedrock or they are the substance of what's happening in Latin America in the pandemic condition. Now in Cuba, as Ms. Rosa Freis mentions, Rosa Freis reaches conclusion in her research about what's happening in Cuba with the elderly and how they're going through the situation, let's say so and so, or in a positive way. uh, the Chilean university also they've observed aging in this university, in the Catholic university. So the elderly are being seen as people who are dealing with this pretty well. And in the city of Buenos Aires, from the unit of psychology of the Buenos Aires University, they also in the research reach conclusions, and it will show you the conclusions of this research. And there's other research from REDIP, that's a network of multidisciplinary elements from 9 Latin American countries, which are now in an analytical process of the data. And in general, we see that people, I apology, we see that people who are part of the survey said that they felt very well and very good. And what I want to highlight is it's a focus. It's people are worried for people that they have close ties to, plus they've had a lot of communication frequently with other people, preferably with friends and family through different means, including social network. Now, the gives us, or different studies give us information about the fact that the elderly might be well prepared to face this mandatory lockdown. Now, when we think about another question, and the question is, how is it that since the elderly are a segment of the population that have to be strict about lockdowns and social distancing, how are our elderly really just achieving this resilience and developing that resilience? So we've grown, and it's what I call the theory as a protective factor throughout life. In this theory, there's different factors that are protective factors that we have listed to detect the factors on time, and foster the use of these tools to detect in anticipation. So we have a quantitative questionnaire, which is a tool as an instrument, and we have the stock or inventory data of the aging conditions and the role of their aging population. We have a succinct instrument, and we're proposing that it should be annexed to another instrument. Now, we have the protecting factors, and those factors are going to be correlated by me to the concept of resiliency, because most of the population who are in lockdown in the aging segment of the population live in their homes. Now, in aging and amidst the pandemic, first of all, the first factor which leads us to have flexibility is the willingness to accept change. If something has happened to some at any age in life, and now in the pandemic, we're willing to accept change. In the population of the elderly, they were willing or ready enough to accept learning new things and start to get connected through different media and networks. Now, this is what we could put in play. This number one factor is something that we should consider for the elderly population in the pandemic. Also, the use there's other tools of computer sciences that can be used to continue being connected with that network of support, not only the support of families, members, and friends, but also they could find support with the professionals that they had already been working with in groups. Another point, another factor is self research, insight, and waiting. Amidst the pandemic has led us to a condition of expecting and waiting. So it's sent us as population to thinking and having insight. So our elderly, the elderly who are well aging in a under dignity, can go through that process of self research, self analysis, insight, and they're just doing that throughout their life. Why is this so important? Self research enables us as people to go through a decision making process on their own. And I speak of the aging population, they can sustain their economy amidst the pandemic, for example, sustaining their autonomy in sometimes sustaining autonomy, led us to also think about what was going to happen with a pension of the senior citizen that's part of our family. So some other relatives added pressure to the aging population who lived alone, and they wanted the other family or relatives wanted them to live with them. But the elderly decide and they can exercise the rights to live alone during lockdown or not, because it's just what they decided to go through the situation. When we're in the decision making process, this is all feasible depending on the capacity that the person has to have those protective factors. The person should be capable of deciding and what to use their time for amidst this lockdown. It's like that insight process. And the third point is also a process or a factor of self questioning. Why is this so important? If you're confined and then you question yourself, and it's clear during the pandemic that the elderly who can go through these analysis of values or principles, you think about what's happening in different generations. What are we questioning? We're questioning what we buy. We're questioning how we interact. And with the elderly, they can we can question the elderly can question like also the relationships that they have that could be toxic relations now, and they can focus on the relations that do them good, that do them well. It's all feasible. All of this is correlated to the capacity of flexibility of the person that can question everything, that can surpass the lack of flexibility when people might say that they're not going to change, that they're a certain way or another, and they're not flexible to change. Fourth point, psychic richness and creativity. Our elderly were capable of connecting with that inner self and rescue and share their psychic robustness or richness and creativity, sharing their dreams, their fantasies, and continue connected and develop on their own other activities which are creative. The sense of humor is also a factor of resiliency, and it's leading us to being creative. Now, amidst chaos, we need to reinvent ourselves. That's why we have to work with creativity. And this is what many seniors have achieved. Self-care and auto-validation, self-validation is clearly happening with the aging population that have been taking care of themselves throughout their lives. They've learned to take care of themselves, to maintain themselves in that validation of self. And in Argentina, what we proved is that people that went over any constraints, that went over certain limitations, that are over physical distancing issues, they were always so useful. They were never part of the aging or elderly. These elderly in the population were capable of taking care of themselves and develop and comply with best practices when nutrition takes place and nurturing oneself in correlation to correct physical activity. Now, the compensation of losses and gaining are people who achieve resiliency can they could compensate. They took these activities or into the exercise or practice. Socially speaking, they've decided to compensate their losses with gain. They can compensate inwardly what could not be done externally. Now, the seventh point, diverse links of interest. This is a core point for the discussion of our panel. I mean to say that people who have faced losses of relations because of retirement or violent situations in their life, if these people had like diverse links with different people, so we're ready to connect with others, and our people were then capable of going through and rethinking their situation of life. So, our people in lockdown in the pandemic maintained a broad variety, broad spectrum of relations and different liaisons or between other generations and different interests. Our people were capable of developing these elements under confinement. But with regards to this, not only are our people open towards the external life, but they're open in this attitude in which they're facing this with solidarity. They worry for others. What we've been capable of seeing is that our aging population were worried not about themselves, they were worried about the relatives and the youth and their families. Now, there's different links
We could
between.
see from, as you said, people that living on their own, they continued with their links through different means, and those who, were helping their, babysitting their grandchildren or helping with the chores at home, being connected all the time with the different generations, either with their family members or outsiders in the gradual elaboration of elderly stage of life. So that allowed them something which is basic. That is to say, they started learning their limitations on life, their limitations that imply to leave or the passing of time. So before these limitations that they have before the pandemic, there are people that they are adequated to these limitations. It's much better than youngsters because they consider these limitations. And on the other hand, as a point of this, they were fighting their prejudice regarding getting old. So that helped them fighting their prejudice around them. And in the second place, the anticipated feeling of, about death. That was around them with all the messages they had for elderly people about the greater index of mortality for elderly people. So they showed with these resiliences that they are warriors of life. They're aware of the possibility of death, but they fight because while they're alive, they want to be alive while they live and they die. So, as a summary, the importance of flexibility and permeability that implies that it's be opening to interiority, but outside too. These two conditions are the conditions that in time are considered proper of creativity, generally speaking. And more in this situation, as I was saying, we want to be recreating ourselves, reinventing ourselves before this adversity situation. So it's about recreating ourselves and transform ourselves before adversity. That is resilience about. So this could be shown in a great majority of elderly people living in their homes. It is not about, being resigned, do not keep up our hopes and things that we want to be living for, but not going beyond the limitations that life itself gives us. So here we have three dilemmas for life, you know, three keys for, I think, are an example to other generations, three keys for a dynamic equilibrium along their lives. First of all, the balance between the wishes and limitations, as I said. That is to say, to learn this means not only the limitations, external limitations, but also internal limitations, to be able to recognize them and take them into consideration. And this implies to modulate our ego. That's pretty important, talk about ego, especially when you get older and before pandemic. Not a lot of ego that is going to let us go beyond the limits, and not so little that we will resign our desires. And the second one is the balance between everything and nothing. The rigid people are people that sustain themselves, by having everything all the time. And resilient people were those who learned that not always is possible to have everything. So this is a balance that we have to get through life. And this implies to learn to be humble. That's an access, a very clear access, being able to get older in a good way and being resilient before situations that we face. And in this case, pandemic. And to accept our vulnerability will allow us to be less vulnerable, biologically speaking. And thirdly, as a third key is the balance between the auto-centering or self-centering, self-knowledge to be connected with our desires and the signs that we want to give to our life, and at the same time, a balance with the decentering, that is to be open to our to other people. So this is what we call the human reserve these elderly people have that allows them to take advantage of the social capital or increase their social capital by being open to other people. We've seen lots of experience of solidarity. Yesterday, for example, I was reading at a newspaper in Argentina in an elderly home of retirement. All these elderly people sewing clothes for younger people. So this balance is important. So as a summary, just to finish with, I would like to say what we call our learning for our policies. First of all, the need to go forward in the interdiscipline for complex topics. That is to say, including policies, gerontologists, and the sciences of behavior, because what we can eventually see, besides getting older topic, the importance the behavior has in people in the situation of adversity like this, which in many times, generally speaking, our countries was very, very emphasized the fact of having the presence of epidemiologists in the biological standpoint of view, but we neglected a little bit with some policies even that were not pretty well adjusted and were inconvenient towards elderly people that would want to not allow them to go out of their house or not let them in to certain places, which of course luckily was fought back and we reverted, at least in Argentina, this trend. The need of sociosanitary care and gerontological programs of, you know, to give gerontological care. So the importance to visualize the need and the convenience of favoring the resilience in elderly people. These programs try to focus on this to generate flexible people. Programs shall be and professionals shall be also flexible. And for this, training is important. What I want to say to this as a summary also is that as a learning point that the situation leaves us is that all these researchers that I mentioned, generally what they comply with is that they show us this resilience that elderly people get is that in general, people that were questioned in these countries are people are mid-income class and they have a good level of education so that they will be able to see this complex vision. I concentrated on psychogerontologic vision, but in order to see all this general pandemic situation, I had to recognize that it is important to see the socioeconomic level of the people that we interviewed, to see the resilience level, the level of education, good conditions of sanitary situation, so on and so forth. And also consider that elderly people are not so well, so desperate of the need to, they're not losing their job like the younger people may. And many of these elderly people are babysitting and helping the children to school. So these are conditions that contribute for resilience. But we also have to consider not only these, the interdisciplinary scope, but we also have to see the subjective aspect that we have to give for elderly people, but also he talks to us about the importance of all these groups that were questioned that are generally contacts of gerontologists. That is to say, that it makes clear that the great contribution made by gerontologists through their programs of stimulation and reflection groups and different topics, even though they're working in networks, not in the networks of professionals with elderly people, but also they're getting to be able, when these elderly people do not have the chance to have a physical contact with their coordinators, they're also open to be connected online. So this allowed them that the physical distancing was not a social isolation. And just to close, I brought from different arenas. They reinforce this idea of the importance of flexibility to sustain life and sustain life in every discipline and field. So we need this flexibility and more in an elderly person. And as Loud says, the flexible and soft will survive, and they are not the strongest of the species that survive, not neither the most intelligent ones, but the most flexible and those that adapt to changes. This is a quote by Darwin, which by his time he would say, just imagine if for the survival of species it is important to be flexible and to be adaptable to changes. It is even more for human beings. So this was evident in this pandemic situation. And in order to give forward further words, I hope I had given enough topics. I will leave you this link in order to widen all these kind of topic, and you can see this class where I talk a little bit further about this topic. Thank you very much, Dr. Graciela. It is for sure a very interesting talk that makes us think of this concept of being adaptable and resilience. And most of it, saying that within the protecting factors that you talked about during your presentation, one of the tasks within the CISS is that we have to reinforce all these guidelines with what we know as the inclusive policy in order to guarantee social security. I think these protecting factors that you mentioned, if they were guaranteed with the access of social security for the general population, may be strengthened. We thank you very much for your participation, and most of it that you were able to adjust your agenda to be with us during all the event. So let's then continue with the second participation, which is on the part of Dr. Mariana Paredes, whose title is Elderly People and COVID, Challenges for the Living Between Generations. She is a professor at the Universidad de la República in Uruguay, where she has taught and made some research at a 3 degree. She coordinates the Interdisciplinary Center of Elderly People. She works for these frameworks where she has had some research international and national wide, and having qualitative and quantitative analysis. She has research and helps researchers, and their topics are getting older, elderly age, and methodology of research. She has a master in uh, human research, a sociology master by the faculty of the University of República de Uruguay, and she has had some courses with gerontologic formation. When some of her papers, are challenges for the elderly people and comprehension of mortality in Uruguay, levels and regional differences between 1996 and 2014 with Mariana Fringhout, all the personal human rights in Latin America and the Caribbean, and some projects where she is participating, the analysis of COVID in elderly people, in the network of elderly people of the Association of Latin America Population, among other studies. And we'll give her now the floor so she'll be able to start. Dr. Mariana, please. Hello, how are you? Good afternoon, everyone. Good morning, some of you. Thank you for the invitation. When Diego told me about this presentation, I told him I don't have any data. I am a sociologist and a demographer. I'm going to give empiric evidence before things. So indeed, I don't really have a new input linked to data in order to answer to this question that I was being asked in this meeting, linked to how this is impacting, the pandemic is impacting the vinculation of elderly people with their families. What I do have is some data coming from COVID, which are not pretty well classified by age, and I was going to give some approximation on how these schedules of elderly people of some research that we had in the Markov Center of Elderly People, and most of it to visualize this thing of networks. Sometimes we think that elderly people are lonelier than what they are, and as Dr. Zareski showed, they're much more resilient than what we actually think. So, in order to tell you about this, we all know this uh, terrible effect that COVID pandemic had and how our everyday life was changed economically with a lack of employment and the social scope, many lots of vulnerability and break of links, isolation, and the threatening of panic linked to health and fear of death and the stigmatization of elderly people linked to their vulnerability and to death. And logically it has an enormous dimension, and I don't think we will be able to really evaluate now. I think this is pretty well visualized later on, but by now I don't know if you're aware of this, what actually happens in Uruguay is between Argentina and Brazil, with a little bit more than 3 million inhabitants that started, having these COVID cases in March 13. We didn't have a mandatory quarantine, which was pretty discussed in the region and in other countries and in the world, the mandatory quarantine, yes or no. And what we really did is to appeal to what we called in that time in communications like responsible freedom, the usage of responsible freedom that implied that we didn't force anybody to do anything because we cannot, punish people if they do not comply, but we suggested and we make some suggestions and recommendations for people. So, in that sense, we suspended many activities, classes at all levels, and between 13th of March and 13th of April, there was an extreme agitation. We had to obey these measurements for quarantine. And one of the other things that happened in Uruguay is that we started seeing the scientific capability or ability rather than the hard sciences, as it was said, to incorporate interdisciplinary matters. It was not really visualized in the country at several levels and means, but there was a group of mathematicians and scientists that give some guidance to the authorities to create policies. So in that way, these made evidence the scientific capability of the country, which is good and the perspective of the importance of the development of science, which in this country does not have a lot of budget allocated. On the other hand, not the interdisciplinary vision or scope of things that what Graciela was talking at the end of her speech. And the elderly people were detected from the very beginning, as you know, as the most vulnerable during the pandemic. And there's some debate between stigmatization of elderly people. That is to say, to homogenize elderly people, such as a stigma that we have to help them, we have to go to them, we have to support them, which makes them a little bit more passive, and try to see, to reevaluate the elderly people, take care of them, and to pay a little bit more of attention, and and so that they will be in the social life agenda. But it's pretty complex, this balance on how we can visualize elderly people in this pandemic. There were some specific measures defined for population, social, economical, and what we did have is, in the case of retirement homes, you know, there was like a prohibition of visits. There was a vulneration of rights there, linked to the fact that the elderly people were trapped, in these retirement homes. They didn't. They were not allowed to have visits, and this happened when there was uh, the problem, in an elderly retirement home. This is the situation of COVID in Uruguay. This is from our rolling data. It's a database that has data from all over the world. And this is the data in Uruguay, which is not continuously published as it happens in Argentina or other countries in the region. But, we have periodic reports every once in a blue moon, every 3 weeks or something like that. The daily reports, give no news about death and infections, but they're not classified by age, and that is a problem. So, as for yesterday, we had this information, which is 1,009 cases. We have just gone way beyond. Uh, there are 69 active cases in the country, and these graphs show us until June the 23rd. So this is the latest information that we have. So this is what was happening a long time with a different specific. Uh, so as you can see, in April the 23rd, these are the retirement homes that generated the most panic in relation with elderly people. So, in this point, I have to tell you that the percentage of elderly people that live in this kind of situation in Uruguay is no greater than 3%. So, the last reliable data that we have is the population census, is what was made like 9 years ago, where we had 2.5 people, 2.5 percentage percent of elderly people. Even updating this data and the amount of people that live in retirement homes does not go more than 2 or 3% in the country. But that doesn't mean, obviously, in the quantitative, that they were like or an impacted population. These events are some things that have been generated in several departments in the country where we have these outbreaks, because we have an important problem with the border of Brazil. In Argentina now, because there's a river in between. So the incidence by age, to this last piece of information that we have, which is a long time ago, is pretty much in elderly people, but it's also high in other ages. So it has been important in 60 to 74, 75 years or more, but also in the lower ages and even younger ages, as 25 to 34 years old. So the incidence of infection is not centered in the elderly people only. So what is actually happening is, once elderly people are infected and associated to other vulnerabilities and other comorbidities, which is another apart topic, has a greater incidence of hospital incomings, as you can see in this graph, that has a greater number of interned people among the elderly people related to younger people. So in here we have the deaths up to here. In the last report on June the 23rd, we had 25. And now up until yesterday, we had 6 deaths. All of them were people older than 60 years. So the incidence of infection is not only in elderly people, but once they are infected, they, you know, the once that they get to the hospital or whatever they have to be, it's greater. And mortality is greater also. This mortality is not reflected here, but it's associated to other comorbidities uh, linked to respiratory diseases, hypertension, so on and so forth. So once we saw this scope of COVID in Uruguay, what I wanted to talk to you about was something that has to be with the family arrangements. In the beginning, you said that Argentina was in the head of the unipersonal homes in the region, but I think Uruguay is greater. When they were giving this data, here you have all the data of how people live, how these elderly people live in Uruguay. So as you can see, there's a percentage. Sorry, this is the marital status, but I wanted to show you this. There is a high percentage of elderly people that live in unipersonal homes. So that is 4%. That is to say, 1 out of 3 people lives on his own. The other percentage, important, is also the people that live with their couple and without children. And then the other percentage, the high percentage that we have is extended homes, which is the elderly people live with any other relative. But this percentage is less than the one with the other family arrangements, which is the per elderly person living alone or with their couple. So this is linked also to the marital status of elderly people. That is to say, what is their situation, marital situation, and it has a great difference. Either they are men or women. So women, which are become widowers, 46% of elderly people are widowers, and 60% of men are married. So this vulnerability of elderly people living on their own, which does not necessarily implies to be a vulnerability. It can be a potentiality, but most of it based on women and even elderly people. So this is the case of 2 age groups of elderly people that live with their couples and the difference between men and women. So here you have the same all along the different ages of elderly people. That is to say, men live more with their couple as they get older. So this is a process that is given a long life. Logically, elderly people live on their own as long as they become older, and they reduce at the same time the configuration of homes of those who live with their children or with other relatives. But some time ago, we had a little uh, questionnaire to try to find out about the networks that are beyond homes, given the fact that in Uruguay we have a high percentage of people that live on their home alone or with people with the same generation. Is that beyond that home, what happens with the networks of elderly people, And first of all, this we reply to the kind of homes and the amount of people that live on their own. And also we were asking about the amount of children and grandchildren and elderly people that we have. And on the left part, 88% of elderly people have children and 82% have grandchildren. So here we have homes according to the intergenerational mingling. So we have a 65% of homes where we only have one generation of elderly people, which means that if these people live with somebody else, they live with a person with the same generation. another percentage of people that live with people with other generation, or a 12% with that live with 2 or 3 generations. Here I have some research that we had on the dependency, where we have this severe or moderate dependency of elderly people is 6%, and the mild gets to 13%. I sorry, 10%. So altogether, the dependency matter in the country gets to a 16% or 17% in the case of elderly people. So we gave them, we got this results. So we have elderly people living on their own, many with their couple, or elderly people with the same generation. And it happens that many people look after other elderly people, given the fact of life expectancy. People that may be 70 or 65 and might be living with a person 100 years ago. So we had to find out the geographical distance between the elderly people with their children, and here we have the data. Those that live in the same neighborhood or another country or city. So we found that there was a very big network living close to each other. So at the same time, one more thing that we found is that people talk, they have contact, a very frequent contact with other family members, and they're
So then, we know that we've gathered and then simply had gatherings or meetings with relatives, and that we've asked them how long do they see their relatives for. And this is something that we were watching over the visits of the seniors towards their friends or relatives or others, or their neighbors, or we're asking them, who are their networks? Who do they see? The idea that underlies here is about the configuration of the households, how they're constituted, in which there are the seniors or elders. There's a network. There's a network, a potential network. We never know how that network is activated and how that data at this moment is data that we can't have. We can simply think about the perceptions of things, and we hope we can get new research or new investigations. But as of now, we don't know when these networks for the elderly were triggered. From the elderly to the relatives or people who are not the relatives amidst the pandemic. Now, lastly, this is research that took place by Lucia Monteiro regarding the perception of the loneliness of our seniors. It's a survey that, as you can see, the perception of this loneliness is pretty low. The level of high self of or sense of loneliness is very low. I mean, in the elderly, you see the percentages there, and the people that feel lonely, there are 54%, or they have that low sensation of loneliness. This is recent data, and to summarize or recap, I believe that, and lastly, I have more data to share with you regarding the use of technology, which is also part of the skills that our people or seniors have had to open, which gives them room to use tools such as internet, and which our population in Uruguay have a lot of access to technology of information and telecom, access to the network, access to the use of internet, etc. But in the case of our seniors, it's lower. The numbers are lower according to data that we've obtained from last year. Even though if the number is low, it goes over that 50%. The seniors had to use at some point, as Ms. Mendez said, they had to develop other skills and strengths to communicate to other networks, with their neighbors. They started using Zoom, they started using other devices like the cell phone devices that they were not used to using, but the use of these devices has intensified. Maybe next year we're going to have more data about the intensified use of mobile devices and digital means. Now, to wrap up, the constitution of families in Uruguay is very singular in the Latin American context. It's similar to Latin America and Argentina, but different to Mexico. Right now, our colleague from Mexico will speak. Some people live alone with significant others or people from the same generation. The relation network that people have, which are constituted by families are very close, and there's contacts and frequent contacts of the seniors of the population, which are active in communicating with others through their networks. Now, how many are now active and use the networks that we have in place? We don't know that. One of the last comments that Garcia mentioned is like the pandemic also generated or made. It was like they were seen as only like a soul mass or homogeneous, but there's a lot of specifications or specs in the threshold or in that layer of aging population, economically speaking, gender issues as well, like they're male or female. And Graciela mentioned the life story of our people. There's different ways to age, and amidst COVID we have to be very cautious when we think about stigmatizing the seniors, stigmatizing the elderly. There's a lot happening. Some think that the aging population have their deficits, and we're all facing problems. They're facing problems that we have to assist them. We have to empower the aging population and our seniors. That's why amidst COVID, and when we think, are they being, they're subjects of rights, they have services that as a right. We have to communicate correctly through the means of communication that we have. There's so many things that have been happening, even in public policy. Our people received what they had to receive. Some of our people maintained themselves, communicated, they activated the networks or media. And I believe that we have to also catalyze that and think about what we're winning or the areas in which we're winning as society. Thank you so much. Thank you, Ms. Mariana, for your interesting participation, your presentation. As you've just mentioned, I believe that's something that we should think about and is developing new research routes, which is correlated to the behaviors of these support networks. We need to learn through the process of the adaptation of the different groups of our aging population. As it's been mentioned, a lot of what's been discussed also speaks of the IT gaps and the gaps between generations. But amidst the pandemic and the new normal has led us to prove that this group of the population is a group that has gone through an adaptation to the new normal. They've accessed new technologies. And there's positives that have been maintained, as Ms. Graciela mentioned, Dr. Graciela, and you mentioned this. So it's factual, and we've shed some light on how we're living through the whole process, along with our aging population and the aging population, which are part of it. There's very important key elements that have led us to adapt and adjust. You just mentioned now if the education levels have to do with this. There's some levels of our demographics in our population, like the specifications if they had kids, if they hadn't had kids, and specifications of this demographics in different countries, which lead us to speak of different scenarios. It's so interesting for us to go through this insight in these working group or work table. There's new questions and there's new answers, and besides responses, there's new questions that appear in the demographic conditions amidst the pandemic with COVID-19. We're so thankful. Thank you so much for being. Now we're going to start now the next presentation of Ms. Marisa Rivaldo. It's the title of her presentation, New Normalcy and the Correlation of Generations Amidst the Pandemic. Marisa Rivaldo Martinez is a Foreign Affairs degree from the Social Political University of Mexico, UNAM. She has PhD in Health Sciences in the collective scope in the Metropolitan University from Xochimilco. She's a member of the aging unit at UNAM and has worked in different research projects in the human development and geriatric disciplines. She studied also programs in social and political guidelines. She has also published different books and has been part of the commission who drafts and designs the degree to understand communitary aging in UNAM. She's a professor also in the disciplines such as communitary intervention, legal issues, and aging and issues amidst aging. Thank you, Miss. Thank you so much, Diego. Thank you all. I'm very thankful for having been invited. and for having the opportunity to discuss and talk to you about these issues. The presentation is titled New Normalcy or New Opportunity because I believe that this pandemic has is offering us the opportunity to go through insight, to rethink how we're understanding aging, and to make our people visible. As our colleagues have mentioned, there's differences in aging. The next slide, please. The the pandemic. If you can change the slide. Uh, the pandemic The pandemic has had, or I've identified, three levels or layers of impact. At a macro level, it has allowed us to see the limitations of the economic systems, but also the way in which the states or economies organize themselves to pay close attention and services to the segments of the population. We must guarantee access to social security. In a medium level, we've seen in the pandemic that there's certain limits in social ways of organizing ourselves in our communities to face scenarios of crisis with a clear understanding about what's happening with empathy, solidarity, and under responsibility. And at a micro level, we can see the lack of fairness or balance. There's an accumulation of structural inequality. We see what's happening with the individuals that are living now at home, and we've seen this at a personal level. We've seen which are the tools that we don't have, to face the pandemic. Now, specifically, the people, the elders in all the world have now, have been experiencing this process in which they're stigmatized. Stigmatization has been mentioned by my colleagues or peers. Lockdown has apparently weakened these networks of support. And in countries such as ours, this has impacted negatively the segment of economics and income, labor issues, and so on. And it's evident and clear that there's a lot of discrimination happening. The elders or seniors that live in the confinement of homes have experienced certain modifications, as Ms. Paredes mentioned. We're going to have to, right now, we have not been capable of finding yet the results regarding the research of what's happening at the present. But what we can see are, some evidence that there's stigmatization and some groups are being excluded, being discriminated, and object of violence amidst the pandemic. This is why we have to analyze the process with a clear perspective to understand the formal dynamism in all this. Next slide. Just to give you the general scope or context, in Mexico, the statistics unit, INEGI, has a report of 15.4 million people in the population who are over 60, which is 12.3% of the population. In Mexico, 26.1% of the households has. The elders, they have in the way they're constituted, members who are seniors, people who are over 60. Some live in their homes, which could be seen as nuclear homes, which are 47.9%. There's people that live in a housing area which has been amplified that are 39.8%. There's people that just live solo in their household, which is only 11.4%. In Mexico, 41.1% of the aging population lives in conditions of poverty. And in general, in Mexico, the Mexican households, it's a number of 38.4%. They already live in conditions of great grievance, or we're facing a new normal. What happened in Mexico? Briefly, I'll tell you that in the case of the aging population, lockdown includes certain measures. As of course, like in any other country, the restriction of visits is imposed. The long-term care centers have also been part of it. We've been very emphatic about or stressed on the points of stay home, be in lockdown in all the government structures in its levels. But besides this, we started to drive forward and the idea of don't visit the elderly, don't visit your grandparents. The families should stay in their homes apart. There were, in some places, exclusive scheduling for going to grocery shopping or shopping. Even there are intervals, scheduled intervals for the elderly, and there were restrictions in establishments in mobility. In Mexico has also led us to important, mobility. CONAPRED, this agency, drafted and published the specifications of what's led us to also see that there's discrimination happening. The most important TV or open TV broadcaster was also communicating this video, which is very interesting. I want to say it's really interesting. Coronavirus is very dangerous for the seniors. Do not visit your grandparents. Maintain yourself away but close to them. They're very clear on the point of using the cell phone, using the video conferences and calls to maintain the relationship between these generations. The communication messages here are for kids and for our youth as well. Next slide. In in other measures, we have what we so the results of the measures in place led us to a process of acceleration of the stigmatization that we've seen, which has made itself manifest in different family scenarios and institutions and communications, which has also been reproduced and intensified by social media and networks. This has been produced in society. It's very important for me to mention that the message has been very intense. Ms. Zarevsky mentioned this before, and Ms. Paredes mentioned that the messages of vulnerability, codependence, lack of autonomy, and economy, and some say that the elderly are all the same, but just for us to have now the opportunity to give this a glance, which I share for you now, here there are a pair of signs that were seen in the country. In these, you can see that's official decree. The entrance for the elderly or seniors is completely prohibited or banned. They insist on having the seniors simply not visit these venues. People who are over 60, pregnant females, and kids as well were like banned. Now, next slide. What are these measures generating? They make realities invisible, and they also make the needs of the elderly invisible, and they make invisible the differences between the aging population. People in aging populations, and 11.4% live alone. If they also have imposed these type of restrictions, or there's these type of restrictions, what could they do to buy their groceries, to for their mobility? If they have to strengthen the generational, connection between generations, but this is not something that we can guarantee in all cases. We've also seen that a 5.9% of the total households are constituted by couples of elders or seniors. And in Mexico, you saw this in the media, in the means of communication. Then the elderly started to think, how am I going to go shopping or buy what I need to buy if I'm going to be restricted in access? At 22.2% of the total households is constituted, for example, by members of the family that are over 60. So that also gives us an idea just about how important it is for the elderly to have their correct participation, and the importance of analyzing even the negatives. And it's important also to think about the negative impacts of restricting the participation of the aging population in other senses or areas. Very interesting is the fact that a 7.7% of the total household is constituted with aging or members of the aging population who are caregivers to their young, their young. Now, there's two groups in the households which are very vulnerable due to the pandemic. Now, and as hard data or more data, it's very important for us to see that the relations that exist now with the elderly should happen only via telephone or remotely. So we know that 38% of the senior population that are over 60 don't have a cell phone. But when we speak of internet, according to the Mexico Internet Association, which carried out a study last year, they've mentioned that 92% of the population do not have an agreement of an internet service provider. Now, this makes it compulsory for us to think how we're really thinking. How about the concept? We're thinking about the idea, new concept of the new normal. The new normal is not the same for all. Let's continue, please. What's happening? What's happening currently? Well, next slide. In the next slide, according to the situation at households, according to the data obtained from UNICEF during this period in Mexico, the emergency calls to emergency service hotlines to 911 were correlated to incidents of violence, harassment, sexual violence, violence in the household, family violence, and they added up to 150,614 calls from the beginning of the pandemic in Mexico. We've tried to make these people visible. We're facing a problem of structural violence here. Amidst the pandemic, it's even harsher in the households. So this is a very tough situation that worries us. The Human Rights Commission mentioned that during the emergency, we have initiated case files. 128 case files have been opened in which there's violence against the elderly, aging populations, and women who are over 60. So, so what's happening now within those households leads us to see and take notice of the tensions and stresses or strains that are the result of many factors. And by many factors, I also mentioned the factor of stigma, which is something that the population, the aging population, is targeted with. Now they're vulnerable, and then there's power struggle in the household, and there's a lack of balance and fairness in the households as well. Next slide, please. Now, another data that is very interesting, which has been also circulating, it's been mentioned frequently, is the theme of what's happening with the LGBT plus community. Now, what they've expressed and mentioned is seen in some in the news. It's been seen in some journals, in some newspapers, in some research journals that have been drafted. The elderly who are part of our communities are suffering greater isolation. We've mentioned, or it's been mentioned, that in general, the community or this community and the elderly or aging population in these communities have had to live with families or relatives that don't accept their preferences. So they're also going through a process of experimenting rejection and violence. In the pandemic, many people went back to their closet. Now, between the pandemic and their families, these people have had to simply not mention who they are to avoid being rejected or objects of violence. Next slide, please. Now, then, we know that the generations and the way that many generations interact are fundamental. And amidst the pandemic, we start posing questions. Is it a new normal or is it a new opportunity? Next slide, please. We know that by strengthening the generation ties and the relations that exist between different generations will always lead us to the positives. We maintain the family history in our memoirs. We transmit generation values between generations and generations. And amidst the pandemic, we're also discussing how to face risks and go through a process of survival. The doctor before me mentioned that those who have developed skills and resilient skills have now set the example. They've become the example of how to face the crisis for our new generations. However, this is not yet happening. The strengthening of our people is not yet happening. It will see it in the near future, though. It's going to be the result of what's customary, the ways in which we interact internally in our homes, internally as countries. Next slide, please. This is only for me to mention now that in Mexico, you see the criteria. The criteria lead us to tag. to tag, and those tags are linked to certain behaviors, to certain actions that now we expect children to develop certain activities, to behave a certain way, and to respond to certain stimuli, different from other age groups, from our youth, different from like the adults and aging populations throughout the development of life. Internally in families, what happens? There's also power being acquired at some point within the households in Mexico. This power is lost when people are aging or part of the aging segment of the population. Now, that's also affected by sociological factors, historically as well, because there's also a vision of the monoculture and psychomonocultures, but those who are people in the aging group of the population, the kid, a child, could have there might be a very unusual behavior and power when you compare the aging to the child, and this new way of simply being part of these families have led us to relate differently. The school happens at home, work happens at home, work and everything takes at home. We're just buying groceries, cleaning the household, keeping it tidy. There's scarcity of resources for many families. And also, there's tolerance to routines, what's customary, and there's issues of different needs. There's new ways of finding leisure time and to just enjoy some time. The new ways to relate lead us to new difficulties. And amongst the difficulties, we can find that difficulties such as a sensation or perception of loss of liberty, problems internally in the household when there's different opinions because there's so many different generations in the household, difficulty to adapt to routines, the deficient management or administration of different situations, and this lack of administration leads us to stressful situations that can trigger violent activity. There's problems due to lack of communication, discussions, and people can get angry. If there's people that feel that their personal space is being invaded, I mean, we're in confinement. There's difficulty to use your time of leisure, but there's also difficulties specifically that we've seen between the relations that exist in different generations. There's a lack of equilibrium in the power struggles that happen in the households. And a very fundamental element of all this that becomes or converts into a very difficult element of simply being together is the aging, and the fact that people see, or the factors such as you're older or simply aging. What's happened is we're at the forefront, and this could be a new opportunity. And I sustain this. Why? Because this pandemic gives us the opportunity now to think and rethink the way in which we redistribute or distribute power in a fair and balanced way in generations which are part of the household. There's new ways to give significance to the roles and the flexibility of the roles. Let's avoid roles being simply imposed, because the males are the ones that contribute economically. The female is the one that washes and does the dishes. Now, this redistribution or of what's happening in power roles would let us have the possibility to endure the situation. It gives us the opportunity to think about the prejudice and stereotypes which we usually simply have to live with. We acknowledge the aging population in our homes as suppliers of great of who they are, not only economically. With time, they also help. The aging population helps and contributes. We must understand. I hope that the pandemic gives us the opportunity to really understand that there's not just activities which are exclusive for some in the household and for others. We can redistribute and distribute the way in which we take care of each other by strengthening the ties that we have between generations. Let's eradicate the concept of aging and being old in the family. Let's respect our individuals at home, strengthening the collective entity we are. So it's a great opportunity to give a new meaning to those who are grandparents. Now, the elderly or our grandparents, whatever they contribute with, they take care of grandchildren and educate grandchildren. That has to acquire a different meaning, because those ties or relationships that exist should be strengthened in the future amongst our generations, the aging and the youth, and it should be naturally done. These should not be enforced or by by mandate. It's just strengthening what that connection that we have by understanding the different significance of things. Next slide. Well, what have we learned? What have we learned? How have we reacted, in a word, amidst pandemic, to have an inclusive culture? One of the questions that arise and that are part of the webinar objective, and I touch this point, this is another phenomenon that allows us to visualize and build a different reality. And by different reality, I mean it's a reality in which the relations that we have pre-established as societies and as individuals, the relations we have with others, with the environment, it should be more balanced based on ways of living that lead us to having a consumption and a way of living that's different. The ways in which we lived and did our things did not necessarily work for us that well. So now we have the three opportunities that I can talk about now as a conclusion. Is first, let's build our us culturally, with that anti-issue with aging. We have to build and not and simply age and see each other just as people, not with adjectives or characteristics that are sourced from our age. The other opportunity that we have in facing the pandemic, we have to comprehend to be capable of transforming. We have a time and place. We can give ourselves the opportunity to inform ourselves, to understand the counterpart, to comprehend the processes that we have to undergo that separate the groups of our people, and to transform
A
in a
collective
collective.
action. And the third one is to look for protagonism of elderly people that they, as it was said by the colleagues, this pandemic has had these two trends. On one side, they stigmatize elderly people, but on the other hand, they at least make them visible. So, but what we have to look for now, at least in Mexico, is that elderly people may be the stars of their own processes of development. And then we will be able to get rid of these inequities that avoid us from recognizing elderly people as social capital. And of course, we, in order to do this, have to place in the core the lived the experience. We have to listen to people and analyze the way these categories such as class, migration, condition, status, etc., they create situations of inequity. And this is pretty important because otherwise we're going to continue to reproduce this idea of normalizing and homogenizing elderly people. And this then could lead us to not take advantage of this great opportunity. Thank you very much. Thank you very much, Dr. Marisa, for your presentation. I do believe it gives us a context to really think of a new reflection on how we have to take advantage of good experiences that have happened in new contexts on elderly population and their work, and take advantage of all these social capital included in the actual experience. If this is a coincidence, if there's a coincidence between the three presentations, we see that we have resilient people and they have this capability of adapting to the new challenges of life. But we also have to learn something, and we have to take this flexibility in front of life. So now we're going to have the section of questions. Out of all those questions that we have received, I'm going to try to ask 3 questions, and I hope that each one of you will be able to give an answer in the order you participated. So the first question, well, there are several questions. They are related to what to do when there is no dimension of public health focused on social and sanitary services. As you previously said, much of what we have talked about in this pandemic is sanitary services that they have to do with the physical and biological aspect of people, but focus or addressed to elderly people. So what could be done when these social sanitary systems are not do not exist, either are not visibilized or do not exist in the public system of health in several countries? And the other question has to do with how, how to deal with everything that has to do with sensibility as for technologies of information. As it was previously said in the development of the speeches, we have said that before the new normality, we have to adopt ourselves to a virtual socialization. But also Dr. Mariana was telling us that indeed not many people have access to, and Dr. Maris also said that not all people have access to a mobile device or a mobile phone. And when this has to do with access to internet, there's also a gap. And another question would have to do with the point of how we have treated to satisfy all this part of the support networks for elderly people when they have to move to a virtual environment. That is to say, how to be able to have this recreation, these elderly people as a right to recreation, by using all these technology appliances. So I will give the floor to Dr. Graciela. Well, as for the questions that they have asked, I will take that is related to having access to technology of information and all those things, given the fact of the importance of having a universe between the different countries. In Argentina, we were able to see uh, those that didn't know how to use these technologies, they had to learn. And it is important to say now that these family networks and the interdisciplinary networks, so how this helped teaching the elderly people to have access to virtuality, this could be seen. And then actually this caused motivation. So this was also positive, where we could see the need of having access. So in this moment, there are several offers of professionals that are giving virtual courses or uh, some other way access, so that they would teach elderly people to have access to virtuality. So there are other public programs that have helped with elderly people to have this access. So for example, in Buenos Aires, several years ago, we have had a program that grants tablets, gives tablets to elderly people, and they teach them to use them, from several years ago. So this was an access that was granted and allowed them in this moment to be more connected. So this is being seen from the policies, but they also had a very important role in the family, intergenerational and family network. So this is what we have to talk about. And the other topic that I would like to talk about the questions is about how to interfere from the gerontologic actions, if I understand the question, to sustain virtuality with elderly people. And that is to say, how to continue having options with the interaction of gerontology and elderly people before this situation. And we also see that as long as there are trained gerontologists that would come and have networks of groups of elderly people, and they would have WhatsApp groups, for example, before the pandemic. So this really facilitated or enhanced the possibility to be connected. That was a great factor of resilience before the intergenerational family network. Also, they had contact with gerontology professionals. So this really helped them to continue participating in such a way. So I want to say that not only in the elderly people that live in their homes, but also that was also seen in colleagues that work in retirement homes, permanent retirement homes, where they tell us that they could be able to have this virtual link with the inhabitants of these homes, not only by stimulating in a certain way with certain topics or issues, but also boosting self management of these people living in these homes. So this provoked positive changes in many people that are living in this retirement home that could be socially vulnerable or biologically vulnerable. But nevertheless, these people were like always complaining egocentrically, self-centered in their own problems and in the fact of sharing with the whole group, not only you know, with the people in there, but the general population. There's a problem that uh, they were able to go out of their bubble, let's say their individual problem, and decentralize to be focused a little bit more on how I can talk to the ones that are next to me. So this allowed that some elderly people were able to enhance their mood, and they were like trying to deal with this self suggestive tears. So these tasks. So this pandemic allowed us to see that if people are trained with these different networks with elderly people, so the resilience factor is really good and helps. So then we'll give the floor to Dr. Mariana. Well, then I don't have many answers to the questions, but I believe that the most complex one is the social sanitary system one. So the first thing for the social sanitary system is to democratize the coverage and access, and second is to generate a specific care for elderly people and their needs, specific needs of health, but in a comprehensive way, not only the classical health, but from other perspectives also. So indeed, if many sanitary systems have collapsed in this case, there are several scales. The first one is the access of good coverage of health, and the second is how to generate a new specific attention for elderly people. And for the TIS, I would say that this is the clearest example and most interesting example and gratifying example in the relation between generations, because a long time ago we had some research about this, and we had this connection between generations that would turn around the link of learning. So the elderly people would learn then from their grandchildren rather than their children. So I think this was activated in these moments, and there were many institutions that generated these apps that would track their activities or whatever through Zoom and some other apps. And I think the greatest worry for this is that today those that they didn't have access or those that do not access, so we could see only the part good of the point, the most positive one. We're not seeing, we don't really know, about people that never connect and never log in. So this is something we do not see, and it is important to know. I think that for the ones that are connected, it really increased the connection and the learning and strengthen the intergenerational links in this sense. Thank you, Dr. Mariana. Now we will go with the Maritza, Mrs. Maritza. So about the question on how to do when our sociosanitary systems are limited, I believe that this situation also gives us the opportunity again to rethink, the health system. So in Mexico, we know that our system has not been a health system; it has been an illness system. So this is the right moment to stop a little bit and look at the experiences and all the knowledge that has been developed in previous decades, and to go back again and set on the table the need to strengthen the primary attention to health. And if we had a system with a strong primary attention to health, then indeed the care and attention of this pandemic would be a challenge, of course, but it would be pretty different from what we are currently living. On the other hand, I believe that we need the social organization with a community perspective. Because in this moment in Mexico, and many questions such as the one I live in the Tlaxcala state, we are not going to solve so easily the problem. And then we were able to work together in actions of community organizations that would lead us to social action that will allow us to establish this bridge between the different levels of government. It is possible that we will be able to go forward a little bit. And now, regarding the adaptation of socializing with the new technologies, I believe that as a country, we need to think again from, the public policy and the access to technology, to democratize access to internet, and from a community perspective and family perspective, we will have to start developing solidarity projects and intergenerational projects that would involve elderly people with the use of these technologies. And we have community experiences developed by the students. Before a pandemic, they were teaching elderly people to use ATMs, which is a very, very serious point here in this zone of a country. So these intergenerational projects related to technology may be pretty useful in this moment. And from the work perspective, gerontologic work, the one we carry out from the community development for the elderly stage of life, we have to continue thinking, suggesting community innovating actions. And of course, many of those are measured by technology, but we cannot make them invisible from the gerontology field. All those people that do not have access to all these technologies or the condition, an internet connection or a cell phone. So we will have to think very creatively on the way we're going to continue helping people, because even with the pandemic, I have the idea that we cannot leave anyone behind. As Mariana said, there is no, we have to accept that there are these people that we do not see because they cannot connect, they cannot log in, or they cannot have a phone call, but they are there. These people are there. And so from the gerontologic field, we have to be creative and stable, uh, stay new community intervention technologies. So we have many questions. Thank you very much, Marisa. Unfortunately, due to time matters, we would only have time for a last round. And these are questions that are focused on what has to do with the topic of rights, on the topic that we were talking about violence that is given on the part of a family and some institutions too. So most of it from part of the society by restricting the access to some locals or commerces. So if you had some idea on what to do to guarantee the human rights of elderly people, and of course, most of it, what to do in order to face violence in the context where many of the times violence is within the homes of these people, that people that live with other generations, because these people have this situation. And so I don't know what your opinion would be. So in my case, I found it pretty interesting. The mention by lawyer Maris about the violent situation. It is also true that in Argentina we have a greater number of claims about violence and mistreating these elderly people. So most of the time by family members and people that they live with. So by relating this from the perspective of the elderly people, more than those actions at a community level that we have to have in order to eradicate this violence. So beyond that, we have some importance of that. Considering all these protecting factors on the elderly person, this can be this pandemic situation has to be have a greater time shared with the people, and that might be more evident the cases of violence that these people are living. So maybe the fact that there might be less they would have more conscious, and that they were like more conscious that they had this violent link. Maybe they could neglect it a little bit because they were able to go out, so that they would have more contact with other people outside. So the elderly people was more conscious about this, so they could exercise self questioning, saying, why should I have to bear with this? So they realized about some toxic links they had. So this was like a way to go out with a greater and better life with healthier links. Of course, we have the intervention here by gerontologics and organizations in the defense of rights. And those are important. But, they were more conscious on the part of the elderly person in order to exercise their rights. But I wanted to talk about the axis of power. It was pretty interesting. I don't know how the power is going to change as life is going forward by inverting power. So what we have to do is getting out of this axis of power that links us. We have to think of that also. It has to do with who's in power over the other one, or is it about talking about affection and recognition of differences with the other person? So it's all these reflections that we have to make us think in the pandemic in order to have a better life. Thank you very much, Dr. Graciela. Then we'll go to Dr. Mariana, please. So the truth of the matter, we do not have data about this. We have had some complaints about violence, but I understand that it's more complaints linked to violence of gender rather than not in big cities, but in mid-sized cities. That is to say, I believe so, but I don't have data about that. But I do believe it is pretty important is the fact of the abusive and mistreatment of in the case of Uruguay. I am talking about these retirement homes. Indeed, the control is not very much, and at the same, it's halted by the lack of visits and so on and so forth. So I think part of this is pretty complex, and we would have to work. We're working in the incorporation of the monitoring on the part of the civil society from this retirement home. So I think this is a fundamental point, because I think this is the most risky part regarding vulnerability. Thank you very much, Doctor. Now, lawyer Maritza, as for what to do in order to guarantee the human rights of elderly people, I believe that the main challenge is to know what the rights are, and This I mean not only to the elderly people that are not aware of their of rights, but also the recognition and knowledge of the rights first on the part of the communities and on the part of public servants that are linked to the attention of elderly people, and also greater commitment at all government levels for the respect of the human rights of elderly people. One thing that I am pretty worried of is the fact that in Mexico we haven't signed the Inter-American Convention. So this point lets us see very clearly what the situation is with the rights of elderly people. How many years we've been fighting for the signing of this convention, and this is also important. So I think this is one of the issues, to know what their rights are and make them of our own, to make them demandable and applicable. And as for violence, um, does, given the extreme violence that we have in our country on a daily basis, and the lack of sensibility that we've all shown, because they tell us now today 854 people died due to the pandemic, and then we say, well, what to do? But at the same time, there were so very many slaughtered people in the country, and we don't even care. We don't even show any pain, because that's common use. It's an everyday thing. So I think we could have together a fight for a cultural change, where we would be sensible again about the importance of living of free violence environments. So this is a joint commitment, and once again, we have to look for having to be empathic and solidarity. And we have to understand that we're also responsible commonly, and if the person that is suffering violence does not tell on that, then he has to be careful about that too. Well, thank you very much, Dr. Maritza. So there are very many questions floating. We're going to let them know through mail, so that you will know what the society is asking about these topics. Then we'll go to what we're going to have a reflection in order to finish of everything that we have had this morning or afternoon in the South countries, to discuss what the role of elderly people has been under social capital in the different homes and different countries in the American continent. And I do believe that by taking some of the points that we have discussed in the last round of questions, is about not discriminating and stop normalizing it regarding this discrimination for elderly people. Because when you were showing these banners saying that the entrance to elderly people of to this kind of commerce places was prohibited, rather than feeling sensible towards what they face to a discrimination event, we would simply normalize it under the idea of thinking this is for their own sake, because it's due to this pandemic situation, so on and so forth. But we do not really realize what the situation is under several sides of the story. So we have to understand that discrimination is not normal. We have to give power to the elderly people. We have to empower them. So by letting them know what their human rights and what their rights they have, and to promote the fact that they can demand these rights and having access to all the dimensions that are convenient to them. And when we were starting the presentation, we were talking about the research made by the CEPAL to see in 2013, 1 out of 4 people of 60 years old or older had access to social security. If we see some of the dimensions of social security, such as the income, home, health, retirement, and recreation of these people, then we see that we are indeed facing different problems. In some contexts, Like, for example, in the case of Mexico, the fact of what the pandemic meant is stopping having some money for these elderly people due to the fact that during their work age, they had no formal jobs that would not allow them to have access to a retirement or some income that would reasonable in order to address their vital needs such as food, clothes, health. And unluckily, a great percentage of these people do not have social security, so they need to go to the society and look for a daily income. The fact of that we have this lockdown meant for many people breaking point in the family economy because unluckily they could not have access to this income. And the other point of social security that has to do with home and warranty, something that we were talking about violence, many of the times it is there because generations, the younger generations or generations that are being under development in the work market, they do not have access to a good home. So they have to, live in their parents' or grandparents' homes in order to satisfy this need. So they are like locked down. So this unluckily may generate problems of violence within the family. Access to health, as it has been previously said, many of the times is a time of access, but also it has to do with the quality of the services that should be warranted on the part of a countries. Many times we've talked about the right of to retirement, and I want to say that many of the times in societies when we were talking about the power and how to empower or how we can visualize elderly people in home and the society. Unluckily, in the society that we live in is very focused on the economic identity. Indeed, if you during your working life you had a profession, then you are treated like this. When you are retired, the age of retired miscalled it because that's the way we call it when we talk about retirement at a productive age. It seems like if it's a social retirement, so we start to devalue the opinion of people. And many surveys that we have had in Mexico, especially the National Survey on Discrimination, says that elderly people start losing that question of evaluating their opinion in the home because they do not give any money or they don't have like an economic power, which actually makes it think that we're full being, individuals, that we have like a label, like a profession or whatever. We indeed have to understand what we, first of all, are humans, and we have to be treated as such, as peers. So what we had is the impact on the pandemic, due to the pandemic, on the part of the American Commission of Elderly Person. We have been linking the effect that the elderly demographic processes, the demographic transition that we have in Latin American countries about mortality.
Due to COVID per million in population, and we have data that's of great contrast. This data, it's not just something that we take as something that's not typical. It allows us to have some insight when there's two variables. When the percentage of the aging population are over 60, and we contrast that to the death rate in the population globally and in country by country, and inputting data of global scale, we have the positives, the greater mortality rate, the greater aging of the demographics, there's greater threat of death. But with this exercise in insights, and when we think about how they apply to Latin America, I mean, we don't have clear data or evidence or statistics that make us or lead us to sustain the previous comment. Now, in Latin America and the rest of the continent, we have systems that deal with the differences. Now, the countries cannot be treated as if they were just a standard or in general. We have to understand the specifics of each country, plus aging of the population, and the seniors in each country are not the same geographically speaking. Now, this is why we must treat or think of the conclusions or the resolutions of the webinar is like there's a lot of questions, but we have to be very specific about the meaning of aging in our demographics and aging, just simply growing older. And we must understand the differences socially speaking, demographically speaking, and also in the exercise of law. And we must study the phenomenon when facing this new normalcy. Now, there's no more left for me to do but to thank you all panel members. Thank you for sharing so much. I know that there was some changes in our dates and appointments. Thank you so much for participating in our webinar. And now the floor is open for my colleague Laura. Thank you very much, Diego. Well, it's right now my turn to give closure or the closure ceremony of today's webinar. Thanks to all our panelists, Ms. Celeste, all of our doctors have given their very interesting presentations. I'd like to highlight certain points. You've mentioned the three keys of dynamic equilibrium, which I consider essential when drafting public policy and going through the assessment of the rights of our aging population, our seniors, to reach a point of balance, to be capable of learning and serving and attending the needs of our people. Now, on the other hand, we have Mariana Paredes. Doctor, thank you for participating. Thank you for your time. Thank you for giving us your time. And I'd like to highlight the following point. In effect, as you've well mentioned, there's gaps. And in this case, the gap it has been catalyzed due to the pandemic. The gap of the use of technology has grown. However, the gap, I believe, is not that broad due to the resilience of the aging population. They have the capacity to adapt when facing problems or challenges that they're having to deal with day to day. And in some of the cases, they've been capable of communicating, of linking by using new technology. However, I I remember the words of Miss Marisa. She mentioned data as the percentages of people that have that internet agreement signed off with internet suppliers, and 92%, according to that study, don't have access to internet. Right now, amidst the pandemic, we're using virtual tools to have these webinars and host these debates and all these instruments. We have to acknowledge that the tools that we have at hand are tools that we can use, but these are not the only way, or nor should these be the only way to have these type of debates, nor to be capable of sharing ideas, nor to just simply continue with those links or physical links, emotional ties that we have. We understand now human frailty. And in that human frailty, we have a lot of work to do to satisfy the needs of all our populations, especially the elderly, because sometimes the elderly are in a situation of great disadvantage amidst the pandemic, not just due to health conditions, but for socioeconomical conditions that we have in Latin America. I thank you all very much. Thank you for being present in our webinar. Thank you all for your time, the space you've given us, for all the questions you've asked. I share the following address. You can send us any mail, any comment, anything you'd like to send us. The email is laura.vidal at CISS hyphen bienestar or BIENESCAR.org. So you can visualize it. It's up in the screen. And I also, in this outreach, I invite you to be part of the other activities that we're going to have during the 24th of August. It's going to be online. It's about another set of conferences. We're adapting and adjusting to the new changes that we have to go through with our online training. And I recap, I thank you so much. I thank you on behalf of Ms. Daisy Corrales Diaz, the chairwoman of the Inter-American Studies on Social Security. On behalf of her, we thank you all. Our pleasure. Thank you very much. Goodbye. Thank you.